Dr. Nardi here, back with another video. Today, we're diving into a crucial topic that affects us all: stress-related disorders. We'll explore how stress impacts our physical and mental health, identify different types of stress reactions, and discuss various ways we can cope and seek treatment. My own memories of the 9/11 attacks remain vivid, just like for countless others who experienced that terrible day. Events like this underscore the profound and lasting effects traumatic stress can have on our well-being. Health psychologists are dedicated to studying these interrelationships between psychological factors, including stress and physical health. First, let's define our terms. Stress refers to the pressures or demands placed on organisms to adapt or adjust. A stressor is the source of this stress, which can include psychological factors like exams or relationship problems, life changes such as divorce or a job termination, or even daily hassles like traffic jams. It's important to distinguish stress from distress, which is a state of physical or mental pain or suffering. While some stress can be healthy, keeping us active and alert, prolonged or intense stress can overwhelm our coping abilities, leading to emotional distress like anxiety or depression, and physical complaints such as fatigue and headaches. Stress is implicated in a wide range of physical and psychological problems, with many visits to physicians often linked to stress-related illnesses, from digestive disorders to heart disease. In fact, nearly half of Americans polled in a study reported an increase in their stress levels, experiencing psychological symptoms like irritability and physical symptoms like fatigue. Our bodies have an intricate response system to stress. The field of psychoneuroimmunology specifically studies the relationships between psychological factors, especially stress, and the workings of the immune system. When we're under stress, it has a domino effect on our endocrine system, which is the body's system of glands releasing hormones into the bloodstream. The hypothalamus in the brain kicks things off by releasing a hormone that stimulates the pituitary gland to secrete ACTH. ACTH then stimulates the adrenal glands located above the kidneys to release corticosteroids like cortisol and cortisone. These steroids boost resistance to stress, foster muscle development, and induce the liver to release sugar for energy, helping us respond to threatening situations. Simultaneously, the sympathetic branch of the autonomic nervous system stimulates the adrenal medulla to release epinephrine, adrenaline, and norepinephrine, noradrenaline, which accelerate heart rate and further mobilize the body for a threat. This integrated response is famously known as the fight or flight reaction, a pattern first described by Walter Cannon. While adaptive for our ancestors facing immediate dangers, constant exposure to modern stressors means our alarm system is often turned on, potentially leading to stress-related disorders. When stress is prolonged or excessive, our bodies follow a common biological pattern called the General Adaptation Syndrome, or GAS, a term coined by Selye. This syndrome has 3 stages. The first stage is the alarm reaction. This is the body's initial response to an immediate stressor, mobilizing resources for challenge or stress. It involves the activation of the sympathetic nervous system and the release of stress hormones. The second stage is the resistance stage, also called the adaptation stage. If the stressor persists, the body attempts to renew spent energy and repair damage, with endocrine and sympathetic nervous system responses remaining high. The third stage is the exhaustion stage. With continued stress, bodily resources become perilously depleted. This stage is characterized by the dominance of the parasympathetic nervous system, leading to decelerated heart and respiration rates. If the stress persists, this can lead to what Hans Selye called diseases of adaptation, ranging from allergic reactions to heart disease and even death, as chronic stress can weaken the immune system. Corticosteroids, while initially helpful, can suppress the immune system with continuous secretion, disrupting antibody production and increasing vulnerability to infections. Beyond the endocrine system, stress significantly impacts the immune system, our body's defense against disease. Millions of white blood cells, or leukocytes, act as foot soldiers to envelop and kill pathogens. Some leukocytes produce antibodies that mark invaders for destruction. While occasional stress may not harm us, persistent or prolonged stress can weaken the immune system, making us more susceptible to illnesses like the common cold and flu, and potentially increasing the risk of chronic diseases like cancer. Psychological stressors, especially intense or prolonged ones like marital conflict, divorce, chronic unemployment, or traumatic events, can dampen immune system responses. Scientists believe that under stress, the immune system becomes less capable of toning down its inflammatory response, leading to persistent inflammation that can contribute to cardiovascular disease, asthma, and arthritis. It's worth noting that much of this research is correlational, meaning it shows relationships, but doesn't necessarily prove direct causation. Life changes, both positive, such as getting married, and negative, such as the death of a loved one, can be significant sources of stress because they force us to adjust. Studies show that people experiencing a greater number of life changes are more prone to psychological and physical health problems. For immigrant groups, a unique source of stress is acculturation, the process of adapting to a new culture. Acculturative stress arises from the demands placed on these groups to adjust to life in the mainstream culture, and it can contribute to emotional problems like anxiety and depression and overall poorer psychological functioning. There are two main theories regarding acculturation and psychological adjustment. The first is the melting pot theory. This theory suggests that people adjust better by forsaking their cultural heritage and adopting the values of the host culture. The second is the bicultural theory. This competing theory posits that psychosocial adjustment is enhanced by identifying with both traditional and host cultures, meaning maintaining ethnic identity and traditional values while adapting to the new culture. Recent evidence supports the bicultural approach, showing that a stronger sense of ethnic identity is associated with better psychological functioning among some groups. However, the relationships between acculturation and psychological adjustment are complex. For example, some research with Hispanic American women links higher acculturation to an increased risk of heavy drinking. And among Latino adolescents, higher acculturation is linked to increased risks of smoking and engaging in sexual intercourse. Highly acculturated Hispanic American girls have also shown increased risk of disturbed eating behaviors. Dr. Charles Nagy, a psychologist focusing on Hispanic Americans, has contributed significantly to understanding acculturation. He observed that the longer Latinos lived in the US, the more acculturated they became, resembling non-Hispanic whites in values and attitudes. His studies found that more acculturated Mexican-American college students had personality test scores similar to non-Hispanic whites and often came from higher socioeconomic backgrounds. However, among lower-income Mexican-American adolescents with depression, higher acculturation was linked to an increased likelihood of suicidal thoughts. His research also showed that more highly acculturated Hispanic couples reported less conflicted, more egalitarian, and more satisfying marriages than Mexican couples, reflecting a shift towards Americanized ideals of mutual respect. Interestingly, acculturative stress was found to exacerbate previous relationship difficulties and contribute to stress among married Latinas. Dr. Negi also explored psychological homelessness in Salvadorans deported from the US, finding that those more acculturated to American life struggled to feel at home back in El Salvador. How we handle stress is crucial, and several psychological factors can moderate or buffer its effects. Coping styles play a big role. When faced with a serious problem, some people pretend it doesn't exist, while others confront it. Emotion-focused coping involves reducing the immediate impact of a stressor, perhaps through denial, avoidance, or wish fulfillment fantasies, but it doesn't eliminate the stressor. Denial, like ignoring threatening information about an illness, can be dangerous. Problem-focused coping, in contrast, involves examining stressors and taking action to change them or modify one's reactions. Another factor is self-efficacy expectancies, which are our expectations about our ability to cope with challenges, perform skillfully, and bring about positive changes. High self-efficacy acts as a buffer to stress. When we're confident in our coping abilities, we manage stress better. Studies show that as self-efficacy increases, stress hormones like epinephrine and norepinephrine decline, leading to less nervousness. Psychological hardiness is also important. This cluster of traits helps people manage stress effectively. Hardy individuals show commitment, meaning they are fully involved in their tasks and believe in what they are doing. They also show challenge, which means they view change as normal and perceive stressors as interesting and challenging, not just burdens. Finally, they show control, which means they believe they are effectual in controlling their lives, demonstrating an internal locus of control. Hardy people tend to use more active problem-solving approaches and report fewer physical symptoms and less depression. Optimism plays a role as well. Seeing the glass as half full is linked to better physical health and emotional well-being. Optimistic individuals tend to have better cardiovascular and immunological functioning and take better care of themselves. Pessimistic thoughts, on the other hand, are linked to more severe pain and distress in patients. This area is part of positive psychology, which focuses on enhancing positive aspects of human experience. Social support is another crucial buffer. People with strong social networks tend to live longer and show greater resistance to illnesses like the common cold, as social support can buffer the immune system against stress. Finally, ethnic identity can moderate stress. For ethnic minorities, a strong connection to one's traditional culture and ethnic pride can help buffer the effects of stressors like racism and discrimination. It's associated with a better quality of life and lower levels of depression among African Americans. Conversely, alienation from one's culture can increase vulnerability to stress. Now let's turn to stress-related psychological disorders. Adjustment disorders are among the mildest psychological disorders classified within trauma and stressor-related disorders. An adjustment disorder is a maladaptive reaction to a distressing life event or stressor that develops within 3 months of its onset. This stressor can be traumatic, like a natural disaster, or non-traumatic, like a romantic breakup or starting college. The maladaptive reaction involves significant impairment in functioning, such as academic work or social life, or marked emotional distress exceeding normal expectations. For example, if you're having trouble concentrating on schoolwork and your grades are slipping after a breakup, you might fit the criteria. There are several specific types, including adjustment disorder with depressed mood, with anxiety, with mixed anxiety and depressed mood, and with disturbance of conduct. If symptoms persist for more than 6 months after the stressor is removed, the diagnosis might change. Next, we have traumatic stress disorders, which focus on how people cope with disasters and other traumatic experiences. Acute stress disorder involves a maladaptive pattern of behavior lasting from 3 days to 1 month following exposure to a traumatic event, such as actual or threatened death, a serious accident, or sexual violation. Symptoms can include feeling in a daze or that the world is unreal, intrusive memories, flashbacks, avoidance of reminders, sleep problems, and exaggerated startle responses. Stronger dissociative symptoms around the time of trauma are linked to a higher likelihood of developing PTSD. Post-traumatic stress disorder, or PTSD, is a prolonged maladaptive reaction that lasts longer than 1 month after a traumatic experience, and its onset can even be delayed for months or years. PTSD shares similar symptoms with acute stress disorder, but its duration is significantly longer. Examples include experiences from the 9/11 attacks, combat veterans, and survivors of serious accidents. Common features of traumatic stress disorders include avoidance behavior, such as avoiding places or situations associated with the trauma, re-experiencing the trauma through intrusive memories, dreams, or flashbacks, emotional distress, negative thoughts, and impaired functioning, and heightened arousal, such as hypervigilance, sleep difficulties, irritability, and exaggerated startle response. While traumatic events are common, most people are resilient and do not develop PTSD. Fewer than 1 in 10 go on to develop PTSD. However, certain factors increase the risk. Event-related factors such as the degree and severity of exposure to the trauma play a role. Personal and social factors also matter, such as a history of childhood sexual abuse, lack of social support, limited coping skills, genetic predisposition, specific brain structures like a smaller amygdala, higher hostility, and dissociative experiences during or immediately after the trauma. Gender is another factor, with women about twice as likely to develop PTSD, possibly due to a higher incidence of sexual victimization and younger age at trauma. It's important to note that while combat and terrorist attacks are often associated with PTSD, the most common traumatic experiences linked to the disorder are serious motor vehicle accidents. Conversely, finding purpose or meaning in the experience and having strong social support or ethnic identity can bolster coping and reduce PTSD risk. From a theoretical perspective, learning theory offers a key understanding of PTSD. Traumatic experiences act as unconditioned stimuli that become paired with neutral stimuli, such as a battlefield or a specific neighborhood, leading to anxiety as a conditioned response. Through operant conditioning, people learn to avoid trauma-related stimuli because this avoidance is negatively reinforced by relief from anxiety. Unfortunately, this avoidance prevents the extinction of the conditioned anxiety, as one needs to encounter the conditioned stimuli without the troubling unconditioned stimuli for healing to occur. Finally, let's explore treatment approaches for PTSD. Cognitive behavioral therapy, or CBT, is highly effective. A core component is exposure to cues and emotions associated with the trauma in a safe therapeutic setting, allowing for the extinction of anxiety. This can involve repeatedly talking about the experience, revisiting the scene, or viewing related media. A more intense form is prolonged exposure, where the patient repeatedly re-experiences the event, either through recall or real-life confrontation, without escaping the anxiety. CBT often combines exposure with cognitive restructuring to challenge and replace distorted thoughts and stress management and anger management techniques. Medication is another treatment option. Antidepressant drugs like sertraline, better known as Zoloft, or paroxetine, known as Paxil, can help reduce anxiety components of PTSD. Emerging and controversial treatments are also being studied. Researchers are exploring whether drugs like propranolol, a blood pressure medication, can interfere with the reconsolidation of traumatic memories, potentially weakening or erasing their emotional impact. This raises significant ethical questions about altering personal memories. Eye movement desensitization and reprocessing, or EMDR, is another controversial technique. In EMDR, clients recall a traumatic image while following the therapist's rapidly moving finger. Studies show therapeutic benefits, but the debate continues regarding why it works, whether the eye movements themselves are critical or if it's simply a form of exposure therapy. According to Occam's razor, the simpler explanation is usually preferred, suggesting that EMDR's effectiveness might be attributable to exposure. In conclusion, stress-related disorders represent a significant challenge to mental and physical well-being, but understanding their origins, impacts, and the various factors that moderate stress, along with effective treatment strategies, provides a pathway to healing and resilience. It's clear that while trauma can have profound effects, our bodies and minds possess incredible capacity for adaptation and recovery, especially with the right support and interventions. Thank you for joining me today. I hope this comprehensive overview has provided valuable insights into stress and its related disorders. Don't forget to like this video, subscribe to the channel, and leave your thoughts and questions in the comments below.